friend, my name is Marcy and today we're going to be doing your musculoskeletal exam. So we are going to start with your hands. Can you just put your hands out? So first I'm just going to look at them. They're symmetrical. I don't see any redness or swelling to your joints. I don't see any muscular atrophy or any nodules. So I'm just going to start palpating your distal interphalangeal joints. Let me know if you feel any tenderness.
No tenderness.
Okay, and now we're going to go to your proximal interphalangeal joints. Again, let me know if you feel any tenderness.
No tenderness.
Okay, and then we're going to move on to your metacarpal phalangeal joints. Again, let me know if you feel any tenderness.
Nope.
So next we're going to check your range of motion. So I'm going to have you make a fist and then open your hands, close your fingers, open your fingers, and then touch your thumb to the other side of your palm. Perfect. So now we're going to go onto your wrist. Looking at them, I don't see any redness or swelling. They're symmetrical, no deformities or nodules that I see. So first we're going to palpate your radiocarpal joint. Let me know if you feel any tenderness there.
No.
Now we're going to go to your distal radial ulnar joint. Do you feel any tenderness there?
No.
Okay. And then we're going to feel your anatomic snuff box. Any tenderness there?
Mm-mm.
Okay. I'm just going to do the same thing to the other side.
Okay.
Okay, so now we are going to test your range of motions in your wrists. So if you can just put them forward, flex your wrist down, bring them upward, an extension, and then put them like this, and then supinate them and pronate them. Perfect. So now we're going to do what's called a Tinel's test. So I'm just going to hold your hand and I'm going to tap on your median nerve. Just let me know if you feel any tenderness. Does anything hurt?
No.
Does anything hurt?
No.
Okay. And now we're going to do a test called Flallen's test. So if you can just put your arms like this, do you feel any tenderness or pain?
Mm-mm.
Okay, perfect. So now we're going to look at your elbows. Looking at them, I don't see any redness. I don't see any swelling. I don't see any deformities or nodules. They are symmetrical. So first I'm going to palpate the acromion process. Do you feel any tenderness there?
No.
Okay, and now we're going to just palpate bilateral, the groves that are next to it. Any tenderness there?
None.
Okay, and then we are going to palpate the lateral epicondyle. Any tenderness there?
None.
Okay, I'm going to do the same on the other side.
No tenderness. No tenderness.
Okay, perfect. So now we're going to do the range of motion in your elbows. So I'm just going to have you put your arms out, bend your elbows, straighten your elbows, supinate your hands, and then pronate. Any pain or anything when you do that? Okay, perfect. So you can relax them.
Okay.
So now we're going to look at your shoulders. I don't see any redness. They look symmetrical. No deformities or nodules when I look at them. So first we're going to palpate the acromoclavicular joint. So just let me know if you feel any tenderness.
No.
Okay, then we're going to palpate the greater humeral.
No.
Okay, no tenderness there.
No.
And then the bicep grove. Any tenderness there?
No.
Okay, and then the coracoid process. Right. Any tenderness there?
Mm-mm.
Okay, perfect. And then the subdeltoid bursa. So I'm going to put your shoulder forward. Do you
Okay.
feel any pain there at all?
Mm-mm.
Okay, so I'm going to do the same thing to the other side.
Okay. No tenderness.
Okay, just let me know if you feel any tenderness.
Okay.
No. Put your arm forward. Okay, perfect. So now we're going to test the range of motion in your shoulders. So I'm going to have you raise your arms above your head and then bend them kind of behind you. I know you're on a table. Perfect. And then you're going to raise your arms like this. Put one over your chest. Put it back. Put one over your chest. Bring it back. Put them by the small of your back for internal rotation and then above your head for external rotation. And now we're going to do a Hawkins sign. So I'm just going to hold your arm like this and let me know if you feel any tenderness. No? And any pain?
No.
Okay, I'm going to do it at a 90-degree angle. Okay, perfect. So now we're gonna move on to your head and neck. Looking, you have great posture. I don't see any deformities or asymmetry. So we're gonna palpate first your temporomandibular joint. So just let me know if you feel any tenderness there. Okay. So now we're gonna do range of motion. So can you put your chin to your chest and then extend your neck back. Bring it back to the middle. Touch your ear to your shoulder, ear to your shoulder, and then chin to your shoulder, chin to your shoulder. Any pain there at all?
No.
Okay, now we're gonna do a test called Sperling's test. I'm just gonna push down on your head. Just let me know if you have any pain or if it's uncomfortable.
No.
Okay. So now we are going to look at your feet. She does have a left-sided sprain that she's in a walking boot, so we're gonna stay away from the left foot just for the foot and the ankle. So we'll go ahead and just do the right one. So looking at your foot, I don't see any deformity, no nodules or calluses or corns that I note, no discoloration. So we're going to palpate first the Morton's neuroma. Any tenderness there? Okay, so now we're gonna do your distal interphalanges. Any tenderness there?
No.
Okay, and then the proximal. Any tenderness there?
No.
Okay, and then the metatarsal pharyngeal joints. Any tenderness there?
No.
Okay, so I'm gonna have you curl your toes and then extend them and bring your heel in, like rotate your heel in, perfect, and then the other way, perfect. Okay, now we're gonna look at your ankle. Again, I don't see any redness, no, or it's symmetrical. I guess your left one's a little bit more swollen, so it's not really symmetrical there. And I do see some bruising to your left one. But no nodules that I see or any deformities right now. So we're going to, you can put this one down. I'm just going to palpate your Achilles back here. Any tenderness there?
No.
Okay, then we're going to look at your range of motion. So put your toes up in the air and then plantar flex them down. Perfect. Okay, so now we're going to look at your knees. I don't see any, you can just relax them. I don't see any redness, no discoloration. There are symmetrical, no swelling noted to the area. So we're just going to palpate the suprapatellar pouch. So let me know if you feel any tenderness there. Okay, now the sides of the patella, any tenderness there?
No.
Okay, and then the tibial femoral joint, any tenderness there?
No.
Okay, I'm going to do the same with this side.
No.
Okay. So now we're gonna do the range of motion. So if you can just, we can just do this one if your other leg hurts. So just extend your knee up and then flex it back down. Okay, so now for the rest of the test, I'm gonna have you lay down and I'm kind of gonna manipulate your legs. So you can just lay on your back. Perfect. So do you want to scoot up just a little bit so your legs are flat?
Yeah.
Or you I don't know that my head will fit. Okay. So first we are gonna do the valgus test. So I'm gonna just lift the one that's not hurting. So you can just kind of rest it in my hand. So I'm gonna push the knee outward and pull the ankle in. Do you feel any pain there? Okay. Now we're gonna do the valgus. It's just the opposite. Do you feel any pain like that? Okay. So now we're gonna do the Lachman's test. So I'm just gonna bend your knee up to your abdomen, and then I'm gonna pull your leg and push your thigh. Any pain there?
No.
Okay. So now we're gonna do the drawers test. I'm just gonna pull your knee forward. Any pain there?
No.
And then we're gonna do the McMurray's test. I'm just gonna hold your knee and then bend your leg in and then out. Any pain there?
No.
Okay. All right. So you can just stay like this. So we're gonna move on to your hips.
Okay.
So we're just gonna go ahead and do the range of motion. So will your left ankle hurt if you bend this leg up to your chest?
No.
Okay, so bend them up to your chest. Perfect, and then straighten them back out. Okay, and then you can relax this one. We're gonna bend this one up, and then I'm gonna have you externally rotate and internally rotate. And you can put that one down, then we'll do the same one for here. I'll be very careful. Internally rotate and externally rotate. Okay. And then we're gonna do the Thomas test. So just pull your knees again once to your stomach. Perfect, you can relax them again. And then we're gonna do the Patrick's test. Put your ankle kind of across your other knee. So like this, I'm just gonna push down. Any pain there?
No.
Okay, and we won't do the other side just because I have to grab her ankle. Okay, so you can sit up. Okay, you can actually stay like that. So we're gonna go on to the spine. So her spine is straight, normal curvature. So now I'm just gonna palpate. So let me know if you feel any tenderness.
Okay.
We're gonna feel the spinous process and then the intervertebral spaces and just the musculature around there. Any tenderness?
No.
Okay, I'm gonna lightly tap on your back. Any tenderness?
No.
Percussion? Okay. All right, so then I will have you stand, and this is the last thing, so you can stand kind of right here where I am. Okay, I'm just gonna have you bend forward and touch your toes, and then bend backwards, kind of hyperextending your back towards me, perfect. And then rotate right, rotate left, and then come back to center, and bend to your right, and bend to your left. Okay, well that concludes our exam today.
Thank
you
you.
for being my patient.
Thank you.